Well, it is officially Guys Are Dummies Month, which we also know as Men's Health Month. That is when the medical industry finds it necessary to actually remind guys that it is important to see a doctor from time to time.
Mm-hmm.
Now, this is not new information to guys, but some seem surprised every June to hear it. Now, there are endless studies that suggest men are less likely to pay attention to their health than women, that they are reluctant to go to the doctor even when they are not feeling well, and that there can be long-term consequences to avoiding doctor's visits. Now, in this week's Health Break, SouthCoast Health Physician Assistant Clayton Miller explains why most men should change their thinking sooner rather than later.
Prevention is a lot easier than treating the underlying problem, right? Preventing something before it's an issue is far more easier to take control of. Far too often I see a lot of them, they're mid-30s, mid-40s, or mid-50s, and they haven't seen a PCP or anybody in 10 years or longer. And so when they come and see me, their blood pressure's through the roof, their heart rate might be sounding a little different. A lot of things that should have been captured probably years ago. So I think what's important is coming to a doctor routinely but earlier, maybe say start in the 20s, and try to make it annually, if not annually, every other year. Routine checkup, check the blood pressure, check your blood sugar, just basic lab work to make sure your cholesterol is okay and make sure your kidneys are healthy as well. Those types of things we can capture and make sure they're not an issue, especially when you get older in life.
Well, one issue Miller says men should be especially aware of is prostate health, because it applies specifically to men, and he says they should also be paying attention to that earlier than they probably think they should be.
Prostate is a gland that only men have, and we should get that checked starting at age 40. Some will say 45 if you're low risk. I see, my rule of thumb is 40. We should do that once a year until you're 75. We do that most of the time through a blood test, right? It's called PSA. So part of the annual labs, we can throw in something called PSA and make sure your numbers are within a good range every single year until 75 is when we stop. Cool thing is, if you go annually, we can check your PSA this year and compare it to how it was last year and kind of keep a close watch to make sure the numbers didn't go up too high or what have you.
Clayton says it's not just a theory that guys are less likely to go to the doctor. He says it's fact. He knows just from dealing with guys, comparing them to women, guys just don't pay as much attention as women do.
I mean, is it just wanting to put it off and kind of kick it down the can, or just feel like, men are invincible? I don't know. What is it?
It's interesting. It's a little bit of all of those. He said guys sometimes will say they're too busy, sometimes that they're not worried about their health. A really interesting factor he also said, though, is that some guys, they don't want to know if something's wrong.
Oh, yeah.
They don't want to go to the doctor and be told, okay, well, now you have to start doing this. But then, he says, when they do get diagnosed with something, they can actually be a little bit more diligent with taking care of their health with the treatment. Even though if they're less likely to have it diagnosed, once they get diagnosed, they're all on board with taking care of themselves.
Yeah, so go ahead and go to the doctor. So you can take care of yourself.
Well, I get an annual checkup. I go to the doctor when I'm supposed to. So, but, I'm also one who, like, if I have a little sniffle or not feeling great, I kind of try to ignore it.
Just push through it.
Yeah, so.